For more on the story, we are now joined via Skype by Professor Syed Marandi from the Faculty of World Studies at the University of Tehran in Iran. Professor Marandi, good evening and thank you for joining us on The Globe.
Thank you.
Now, we understand that the death toll inched closer to 1,000 Tuesday afternoon. This must be very fearsome.
Yes, it is a very difficult situation. The outbreak in Iran was reported quite early. The belief in Tehran is that many countries are also facing very serious situations, like Turkey, like Pakistan, like India, and other countries, but they are not openly declaring their numbers. The Iranians, from day one, they were very open about it. On the day that they received the first kit to detect the coronavirus, they began tests, and 2 days later they discovered the first victim of the virus through the kit, and on that very same day they made a public declaration, even though it was 2 days before the parliamentary elections, and it caused the turnout to decrease substantially. So the Iranians have ever since been working very hard to deal with the problem, but the American sanctions are a major obstacle in preventing the spread of the virus.
Now, the Islamic Republic's Supreme Leader, Ayatollah Ali Khamenei, has issued a religious ruling prohibiting unnecessary travel in the country. Is this being heeded by Iranians, and if not, why are they ignoring this advisory?
Well, first of all, in your introduction, it was said the clerical rulers of Iran, and I think that is a very Eurocentric Western term. Iran has a constitution, Iran has 3 branches of government, and the leader is a religious figure who is elected by a body that's elected by society. That is his personal religious statement, but it is not an obligation. Obligations are made through parliament or through the government. At the moment, the government has not decided to establish any quarantine because the WHO, until this moment, does not believe that quarantines work. But the Iranians are pursuing a policy of social awareness and through public awareness, keeping distances between individuals, and also making sure the public space is as clean as possible to prevent the spread of the virus. But of course, mosques have been closed, churches have been closed, synagogues have been closed. Many public spaces, pools, recreational centers, they've all been closed. But there is a problem with that is we are on the eve of the Iranian New Year, which is the first day of spring, and it is a time when people go on vacation, and this is going to be a major challenge. The government right now is encouraging people not to travel, but it remains to be seen what percentage of the people will listen. Many are saying that the government should prevent the public from traveling, but so far we haven't had a decision from the Rouhani administration.
Now, Prof, we understand that hardline Shiites continue to storm Iran's shrines closed over the coronavirus. Are these reports confirmed?
No, this is another misleading statement that usually comes from the Western media, like the issue of freeing political prisoners. Those who are in prison are not political prisoners. They were rioters who destroyed banks, hospitals, ambulances, police cars, and killed people during the riots a few months ago. They're the only people who arrested it. No one is in jail because of a particular political belief. And with regards to the shrines are closed. Last night, a small group of people attacked the shrines in order to enter them. But these extremists, actually, they're based in London, and they have 11 television stations, and they are funded by the British government. They are not influential in Iran. They're a small extremist group, but last night they attempted to break the doors of the shrine and go inside. The police ultimately expelled them, and that matter is over. But that's the only instance that we had. It was last night, 2 different shrines, a couple of hundred people. They went inside, the police told them to leave, and that's the end of the story. So that's not really a big issue.
Now, Prof, you painted a picture in the beginning when we started our discussion with regards to the figures of, the number of infections and the number of deaths so far. What's the true picture of what is happening in Iran with regards to the coronavirus and the infections and the numbers that have been filtered through?
Well, almost 1,000 people have died until now. Today, the number, I think, was 140 or 30 or 50 or something like that. The numbers are rising. The government is trying to curb the rise of the virus as much as possible. But again, there's a debate going inside the government as to whether they should prevent people from traveling outside the cities during the coming holiday. Personally, I think they should, but I don't think that's the decision that they've made at the moment. But there is a major obstacle, and that is that Iran is having major difficulty importing the necessary equipment to stop the virus. The Americans are determined to prevent Iran from being able to deal with the virus. They are trying as hard as possible to prevent Iran from even purchasing kits, let alone hospital equipment and medicine. But the extraordinary thing about this policy that's being pursued by the United States, which, by the way, is also pursuing in Venezuela as we speak. But the problem with this policy is that this virus does not have respect for borders. If the Iranians fail in dealing with this virus, it will only spread across the world. And the Americans will not only be killing Iranians, but they'll be killing people from across the world. So this is a major challenge that the government faces at the moment. Breaking the sanctions, importing the necessary goods at a very rapid speed, because time is very important. And when the Iranians cannot use the global banking system, that makes purchasing goods much slower. The Europeans have not provided any aid to Iran except for some very small amounts from France. The Chinese have been supportive. A couple of neighboring countries have provided aid. But other than that, Iran has had very little support, and it's being hindered by the Trump regime.
And how are medical facilities coping with the high number of deaths in the country and infections?
It is a major challenge. Hospitals are working 24 hours a day. Hospital beds, in many cases, are full. Iran has a world-class national primary health care network. And a lot has been published on it, and you can find a lot of material on it online. But the problem is that the sanctions over the past few years have made it very difficult for the Iranians to meet their current demand. And this virus has increased demand, obviously, significantly and very suddenly. And therefore, not only has Iran had difficulty in keeping up over the last 2-3 years, but now suddenly the needs are much higher, and the American pressure to prevent Iran from being able to import any medicine or any kits whatsoever continues unabated.
Prof, how is the country coping with the number of dead in terms of the burials?
Well, the numbers in Iran are much smaller than Italy. It's not as if tens of thousands of people are dying. Up to now, almost 1,000 people have died, and they're spread across the country. So in a city like Tehran with 10 million people, the numbers are so far quite small. But the issue is that if this is not contained, the numbers will rise dramatically. And the point that I'm trying to make is that the healthcare system in Iran is working night and day. But again, if Iran can't obtain the materials, the equipment, the medicine necessary to deal with the virus like any other ordinary country, then the problem may not be resolved, and it could increase, and the virus will spread across borders into other countries as well as a result of the policy of the U.S. government.
Just looking at reports that have filtered through with regards to some Iranian politicians and officials, both sitting and former, having died of the illness, and about 13 or so infected. Do you think that this will be a clear sort of warning to Iranians to heed the call with regards to the health advisory and guidance that has been issued?
Well, many of these people who were infected, these senior government officials, were infected because they were in the front line fighting the virus. They were visiting hospitals, they were checking different healthcare centers to see what the situation is like and what problems people are facing, and they fell victim to the virus themselves. So many of these people are heroes. Instead of sitting in their offices, they went out in the field, and they were part of the battle against the virus. But again, while the population is concerned and while the government is working to deal with the virus, and while there are differences within the government about certain issues, how to deal with travel, as I mentioned earlier, during the new year. But again, the major problem is that Iran is having grave difficulty in obtaining the materials needed to fight the virus. The Americans are determined to prevent Iran from overcoming the virus.
And what's been the role of the WHO with regards to Iran and maybe assisting in terms of the sanctions imposed on Iran with regards to the UN sanctions, and dealing and ensuring that Iran is able to get the medical equipment that is needed or required to assist the people of Iran?
The WHO has cooperated with Iran. A team has visited Iran for a week, and they were very impressed with how the Iranians have been dealing with the problem. And they, too, were not supportive of the notion of a quarantine when they were here. However, their capabilities are limited. The first kits that came into the country were actually given to Iran by the WHO. And if it wasn't for the sanctions, Iran would have been able to obtain the kits earlier. So the WHO did play a very positive role, but their resources are very limited. And they obviously cannot deal with this problem on their own. And the U.S. government, their power and influence and their sanctions go well beyond the WHO. When independent countries are intimidated by the United States, such as the South African government. The South African government is opposed to the American sanctions, but they have done nothing to stand up against them. And that is the case for many other countries as well. So the WHO can only do so much.
Professor Syed Marandi, thank you so much for joining us this evening. That is Professor Syed Marandi from the Faculty of World Studies at the University of Tehran in Iran, joining us there via Skype.